So this is part one of setting up for an isokinetic dynamometry test, specifically looking at a concentric knee flexion extension test. Now, a couple of things to be aware of, as we said before. Firstly, you have to consider the context under which we're performing the test and why we do it. The information that we gain from this is the same thing that we would gain from a manual muscle test, but we are able to quantify, we're able to put numbers to it. It's also important to remember a few basic principles. Firstly, we are not testing individual muscles. It is also strictly not true that you can say you are testing an individual muscle group. Rather, we say that we are testing the function of muscle groups. So the knee flexors, the knee extensors, the elbow flexors, the elbow extensors. We cannot say when we perform, say, an elbow flexion test that we are isolating the biceps brachii, because strictly speaking, we're not. There are other elbow flexors involved. There are 4 in total. So we say we're testing the elbow flexors and the elbow extensors. Remember that depending on the test that you have to perform, a appropriate warm-up will be necessary. This doesn't have to be anything specific, and for your assessment, this in particular you can just say that this needs to be done. So for a lower body test, something like a knee flexion extension, you could say just a light aerobic warm-up on a bike, or just a brisk walk is more than enough for 5 minutes or so. If it's an upper body test, the option of using the upper body ergometer that we have in the other laboratory equally is acceptable. So, the first thing you need to do is select the correct attachment. Now remember that your attachments for the assessment will be provided for you, but if I just go closer to the camera without falling over, you can see that if the worst comes to the worst, there is an image on each attachment of what the attachment is for. This is for knee flexion extension. There is also, if there is a left and right side, an L or an R to indicate whether this is for the left limb or the right limb, and a small dot that coincides with the dot on the dynamometer head, just here, that you can align when attaching the attachment. So, first thing we'll do is attach our attachment. Just make sure it's on there firmly, and screw it on nice and tight. Now, whilst this is an important part of an isokinetic test, remember that the assessment is assessing your theoretical knowledge and understanding of this topic. So if you struggle with the fiddling bits here, please don't worry about it too much. If we need to step in and give you a hand, it's not going to be detrimental towards your grade. Okay? So the next thing you need to do is get your participant in position. So there are a number of things that we can adjust. I won't move the camera for this, but the headrest can move up and down. Not a major issue, but if you wanted to, that's certainly something you can consider. It's best to start with the chair away from the dynamometer head to begin with. The paddles on the floor allow you to do this. You press them down firmly and can slide the chair back in the fore and aft position. Remember that once the dynamometer is set up, there are numbers all over it. So in the fore aft position, in the position of the dynamometer head attachment, that is numbered. And when you come to test the other side, the contralateral side, those numbers can be replicated on the opposite side. So if I'm currently at position 18 on the right hand side, when I come to do the left hand side, I can move the dynamometer head over to position 18 and it should be in the right position. To turn the dynamometer head around, we simply loosen up the attachment here and spin it round. It rotates a full 170 degrees. We can turn it back around the other way, remembering of course to tighten it back up again once you're finished. The chair, you can't see this from your position, but the chair can also be elevated and depressed by 2 paddles that are on the back of the chair. On the base, at the very back, you just pop your foot on and that will raise and lower the chair accordingly. So once your participant is in the chair, we need to try and standardise their body position. So the first thing to do is to make sure that their legs are hanging over the chair in an appropriate position. So if they're sat too far back, the pad will restrict their range of movement. If they're too far forward, it might be uncomfortable. They might not feel very well balanced on the chair itself. So if we were doing research, we would look to standardise this by measuring, just with a simple ruler, the distance between the back of your participant's calf muscles and the front of the chair. If we're just doing a test that doesn't require such stringent measurements, we can just place 2 fingers behind the participant's leg, and as long as there's a 2-finger gap between the front of the chair here and the back of their calf muscle, then we're happy with that they've got enough range of motion to perform the test and they should be comfortable. You can adjust the 4.5 position of the backrest by turning a small handle that's just at the seat height at the back of the chair here, which you can rotate and will shift your participant forwards and backwards in the chair. So once you've got them set up and they're comfortably in position, you need to restrain your participants. So it's best to start from the top and work your way down. The shoulder straps go over the shoulder like this and underneath the opposite arm. The straps need to be in the right position across the shoulder, so not down here, okay, just for comfort's sake, okay. They are then clipped into position by lifting up, clip here, threading the strap through, tightening up, making sure it isn't twisted, pulling that down, and that will restrain your participant. So the chest straps are to prevent excessive flexion of the torso. You then want to work your way down. This strap goes across the lap. Again, it needs to be central, not skewed too far to the side because it will just be uncomfortable for your participant. Clamp that into place. Finally, one strap over the thigh here. Again, you need the strap to be in the middle. You need to make sure your participants' pockets are empty because this could potentially just cause discomfort. You can just put anything that they have in their pocket to the side. So remember that the idea of the thigh strap is to prevent excess hip flexion. The chest straps to prevent excess trunk flexion. In layman's terms, you're trying to prevent your participant from cheating the test. You're trying to isolate the movement that you want to assess. In this case, flexion and extension of the knee. You can see there, this chair positioning just by pure coincidence is perfect for me. The chair isn't getting in the way of the movement, and I'm not hanging off the edge either. Okay, and the straps need to be checked in between each test. So if you're doing multiple tests at different angular velocities, say you're doing a 360, a 180 and a 60 degrees per second test, then you need to check in between tests during the rest period to make sure they haven't worked them loose, particularly if your participant is really working hard at it, trying hard. It's likely that they're going to wriggle loose, so just check them, make sure they're tight. You're not trying to cut off circulation, but you are trying to restrain their movement. We have to be considerate with female athletes and also anyone that's carrying excess body fat, that they are comfortable. And also, probably should have mentioned this at the beginning, but remember to ask if your participant has any recent injuries to the area that you might be testing, because this is going to influence whether or not you can do the test. But if you hang around for the next video, we'll look in more detail at how we set the chair up once we've got a participant in place and ready to go.